All right, good morning, everyone. We are happy to have you here at the Hunger and Health Forum. We're going to be talking about the power of the federal nutrition programs today with some experts from the state of Wisconsin and from Feeding America and the national office. So we appreciate you all joining us today. I am Maureen Fitzgerald. I'm the Vice President of Government Relations for Feeding America Eastern Wisconsin. I'm going to go through some housekeeping things before we kick everything off today. I just want to let you know that we really value your voice in this, and what we want to have is a robust discussion this morning. And so if you could use the chat, please do. We want to answer your questions and make this session worthwhile to everyone who's attending. So please feel free to use the chat. If at any point you have difficulty using the chat, we found that refreshing your screen or using your Google browser works well. At the end of our panel discussion, after some Q&As, we're going to break into some small group discussions, and there will be some notches at the bottom of your screen that you can pick the room that you're going to go into. We're just asking people to start from room 1 and work your way up to room 10 as we break out, just to make sure that we have robust discussions in each room. At the end of this, you're able to rate and comment and tell us how we did today. We want to make sure that these forums are a valuable discussion for everybody. So please feel free to rate, give us feedback, tell us how we're doing, and things that we can do better into the future. For everyone's knowledge, these sessions are recorded. So just so you know that, these are being recorded. And then lastly, please mark your calendars. We have an in-person, hopefully, cross your fingers, Hunger and Health Summit scheduled for April 24th through 26th at the Chula Vista in Wisconsin Dells. And with that, we're going to start our discussion today. So I'm going to kick it off with just sort of grounding in one, thanking you all for being here. It's a Monday, right? And a beautiful October day in Wisconsin. And we understand that we all have lots of demands on our time, but also it's difficult to sit in front of these computers still, right? And so we really thank you for joining us in this discussion on hunger. It's so important to address how we can strengthen the federal nutrition programs and make sure people have access to food resources in our state. We know that about 500,000 people are food insecure in the state of Wisconsin. It's about 1 in 8. It's even higher for kids. And frankly, Wisconsin has one of the highest racial disparities in food insecurity in the country. So this conversation is very important, and we want to make sure that we are acknowledging that we appreciate your joining us today as we get started. I always sort of think about my time in working in food insecurity, and one of the first things I worked on was school breakfast and connecting kids to school breakfast. And I had a dad come up to me. I was at a school board meeting in Cudahy, and he said he called the school every single day to not provide breakfast to his child, even though he knew she was hungry, because he couldn't afford it. And so that stuck with me in the work that I do. I know that there are kids all across Wisconsin that rely on healthy food during the school day to be able to learn. And these programs are really invaluable to families all across our state. So we've got a great lineup of experts today. I'm going to pass it off to Kari from Feeding America National, and she's going to talk to us a little bit about the federal policy response to COVID. We have to start, we have to acknowledge the pandemic when we get kickoff today. So we're going to talk a little bit about what the federal nutrition programs have looked like for the last 18 months and the significant response from the federal government and sort of the heroic efforts of the experts here in Wisconsin to the pandemic. And then we're going to talk about what the future looks like of the federal nutrition programs as we go forward. So Kari, I'm going to hand it over to you.
Great. Thank you so much. And thank you so much for having me here today. I want to start by thanking you all. I think you, Maureen, really said it with the heroic efforts of people in your state. All the work that you've done thus far I mean, we say this all the time, what an unprecedented time, what a crisis, but thank you, truly thank you. I also want to reflect on the fact that this is one of the first times that I feel like I've been able to stop, pause, and really think back in terms of everything that has happened since March 2020. And I started just making a list of all of the different policy changes, new programs, and federal responses to poverty and hunger. And the list kept growing and growing and growing. And I thought that, if I had any type of musical talent, I would sing it to you all in a Billy Joel, we didn't start the fire kind of style of look at all of these things that have happened. But I'll spare you that pain and bring up my handy list right now just to kind of go through some of the top line things that we have seen, because thanks to all of your advocacy and your work on these programs, there has been significant investments and improvements in nutrition during COVID-19. So just a few off the top of this list are, starting in March, the suspension of SNAP ABOD time limits, which was a total 180 because we were expecting a pretty harsh rule to take place just that next month. And then we saw emergency allotments in SNAP. We saw flexibility waivers. The PEBT program was created, which is massive and huge. And I know some of my colleagues will talk more about that later today as well. We saw child nutrition waiver flexibilities, unemployment insurance, stimulus checks, the eviction moratorium, with more legislation passing, additional money for USDA food purchases, additional stimulus checks, extensions of those programs that we had seen, expansion of the child tax credit. The list can go on. And I think that my extremely eloquent summary of this is just that, wow, whoa, we have seen a lot. And I think that it's one of my, I think a lot of you in the audience right now are thinking, we have seen so much, but also at the same time, you're still seeing people facing hunger. And I think both of those realities can exist at the same time. And it just underscores something that we all know too well, which was that COVID-19 is and continues to be catastrophic, but our best tool to fight it is strong nutrition programs. So I will pass it back to my colleagues now to dive in a little bit more to nutrition programs. Maureen, I'm still going to touch on what to look forward to at the end, correct? So I shouldn't do that now? Great.
Yeah, I think that was perfect grounding in sort of where we are and what it looks like through COVID. So I'm going to let Kari go. I just sort of let the group know that I didn't give a introduction for everyone. So if everyone can just explain sort of what their expertise is, I think that would be helpful for the audience.
Sure. Am I going next?
Yep, it's all you.
Okay, great. Good morning, everybody. My name is Carrie Malone. I am the WIC and Nutrition section manager in the Department of Health Services with DHS here in Madison. I'm also the state WIC director, so I'm going to talk a little bit about the WIC program. I just want to give a little bit of background information on myself and WIC before I get started. So I've held the position as the state WIC director for only about 6 months now. Previously to that, I was the state nutrition services coordinator here in Wisconsin. And then previous to that, I worked for 5+ years for the department, California Department of Public Health in WIC, and also have local agency experience of about 16+ years in Minnesota WIC. So altogether, I've got 20+ years of experience with maternal and child health and the WIC program, and definitely really never have ever saw myself leaving any position within WIC because I truly believe in this program. And definitely have the job of my dreams right now here in Wisconsin, directing this program. So WIC stands for Women, Infants, and Children. Those who qualify for WIC are pregnant women, postpartum moms up to 6 months, and then breastfeeding moms up to 1 year postpartum, and then infants and children up to age 5. Families do need to be income eligible to apply for WIC, but many that are all on some of the programs that are represented here today, FoodShare, Badger Care Plus, Medicaid, automatically qualify for WIC. What are some of the benefits that WIC participants get on this program? Nutrition education, one, it's very different from FoodShare in that aspect. We provide nutrition education on a quarterly basis to participants, as well as breastfeeding support. And then definitely we pride ourselves on really care beyond WIC with providing additional resources and referrals for families. And then, as many of you may be aware of, as you've seen in the grocery stores, we have certain healthy foods that are available for WIC participants to purchase at qualified vendors. And we also welcome dads and foster parents into the program. So just want to kind of give a special shout out to those groups of folks too that we serve. So just talking a little bit about WIC during the pandemic. Wow, we are forever changed by the pandemic and WIC. WIC has been operating, as Corey mentioned, under some child nutrition waivers. So we were able to waive physical presence and some other things for the WIC appointment during this time. So the physical presence waiver was huge for us because it meant that we could do appointments and issue benefits over the phone. So luckily enough, we're on a more of an EBT card, and you can push benefits out through our MIS or our computer system. And so we're kind of forever changed in that aspect of looking ahead, and how we continue to provide services. We also have fell under the public health emergency, so we are continuing with being allowed to provide remote services for families until at least, we just found out Friday, until at least mid-April of 2022. The other sort of big piece with WIC during the pandemic was families, feeling safe and comfortable to get into the grocery stores. So we really wish there would have been some different flexibilities with online ordering and online shopping. But I don't want to talk about that too much, but that's probably the future of WIC. So definitely we've still been able to operate WIC in Wisconsin, doing things remotely. Staff have been in their clinics in all WIC is actually services in Wisconsin are in all counties, but they've just been sitting from their office and been able to call participants to provide them services, which has been a huge relief and for participants and for staff to keep all of our families safe. And I think that's probably where I'll stop for now with WIC.
So thank you. So I think you can tell from Corey and Kari that we have assembled the dream team here for sort of showing the federal nutrition programs, both from a policy perspective and then on the ground of what's happening in Wisconsin. And we've got two more superstar panelists that are going to talk about FoodShare and the child nutrition programs. So I'm going to pass it over to Mary to talk about the child nutrition programs in Wisconsin, but begin by hopefully explaining sort of how your program intersects with hunger and health and how the pandemic impacted the programs that you work on. And hopefully all of the questions are percolating for everyone because you've got an excellent panel. So start thinking about your questions.
Well, thank you for that great intro. Once again, my name is Mary Augustine. I work with the State Department of Education or Instruction, DPI, here in Madison. I am a nutrition program consultant. So we work really closely with schools, both private and public throughout the state and the USDA. To run and operate these child nutrition programs. So child nutrition programs show up in your schools and communities through school lunch, school breakfast, after school snack, weekend meals, after school meals, things like that you most likely have seen possibly greater awareness since the pandemic has hit. So the first thing I want to do is really highlight our great team of school nutrition professionals across the state that are really doing that hands-on everyday work and keeping those meals flowing to families. Really, it was an overnight response for lots of school districts and school district professionals and administrators to understand that we are moving to a virtual learning model, and that meant that school nutrition and school meals also had to adapt at the same time. So How that you probably saw that in your communities were the prevalence of to-go meals, parents being able to pick up meals in that drive-through type of service model. We were able to bundle meals together. So you might have seen a breakfast and lunch served together, or in some cases, maybe even a week's worth of meals served together. And really all that was possible through our strong partnerships with the USDA. So we worked really closely with schools on one hand and the USDA on the other hand to get some really important waivers implemented, and those have since been extended a few times. The waivers that are in through this school year extend through June 30th, so the whole school year. And we have a meal service flexibility. So once again, that's at non-congregate meals, allowing for to-go meals. We have some waivers around service times for breakfast and lunch, so the meals could be served at different times, and that also really helps with that social distancing, kind of extending those lunch hours, extending those service times. And then we have that parent guardian pickup waiver is still in effect. So that really allows if somebody needs to quarantine, or if there's a guardian needs to pick up meals, it just really allows that flexibility. So flexibility really was the biggest highlight, I would say, within the changes and the adaptions within the child nutrition program, is us working with the USDA to be informed of what schools needed to be able to continue to provide this high level of food and meal service. And really, we saw very few disruptions in food service. So that really brings it back to the hard work of those school nutrition professionals. And I also wanted to give a shout out, if you want to see some highlights, we have Wisconsin DPI School Nutrition Programs Facebook, and you can find those school nutrition heroes highlighted. We try to highlight once a month, so you can go a little bit more of a deep dive into a district. And we'll be talking a little bit more later about kind of the ins and outs of going forward. One other thing I wanted to highlight was that meal claiming is also a different waiver that we have. So we know that schools have been under a lot of pressure. Meal costs are going up due to food costs. We have extra packaging for those to-go meals. Staffing can become a little bit scarce as, our economy rebounds. So all schools that have opted into the SSO program, which we are very excited to say all schools across the state have, they're getting a higher reimbursement this year for those meals. So all kids are eating for free, which means more meals being served, and then we're being reimbursed at a higher level. So hopefully those school lunch programs and those school nutrition programs, including the community nutrition program, CACFP, will be able to recoup some of those costs, which we're really excited about also.
Yeah, thank you. When I think about that father who's told me, he couldn't afford breakfast for his daughter, often hunger is hidden in our community, right? It's something that people struggle with in silence. And I think what we learned during the pandemic is it really took all of us working in new ways to make sure that we're reaching all of those families in need and people who were struggling in our community. And I think it became much more in the forefront of a lot of people's minds. So I think as Carrie and Mary showed us, the programs in Wisconsin had to change on a dime and really learn a new way to deliver programming. And I think, I joke with them that their teams wear capes, right? Like they really have been remarkable and heroic during that. What Jess is going to tell us is that it wasn't just programs changing on a dime. They had to create brand new programs from scratch during a pandemic and really learn a new way to feed kids. And so I'm going to hand it over to Jess to talk about the amazing work that she and her team have done in the state of Wisconsin around Pandemic-EBT.
Thanks, Maureen. Rounding out the crew here. As Maureen said, my name is Jess Rutstein. I am a program and policy analyst on the FoodShare policy team here at the Wisconsin Department of Health Services. That said, for the past year, my primary focus has not been on FoodShare, but has instead been on developing and implementing the Pandemic-EBT program. So Pandemic-EBT, or it's often referred to as PEBT, is a program that was authorized by the federal government in 2020, shortly after the start of the COVID-19 pandemic. Generally speaking, it was created to provide financial assistance to families whose children would normally receive free or reduced price meals at school, but because of the pandemic, were unable to receive those meals for some or all of the school year. So DHS has since then facilitated the creation of 3 main sort of sub-programs under the broad PEBT umbrella. There is school PEBT, aimed at assisting families of impacted school-age children. We have what we call pre-6 PEBT, which is aimed at assisting families of impacted childcare age children, or those who are under 6 years old. And we've since created summer PEBT, or I shouldn't say created, but we've implemented summer PEBT, aimed at assisting families of both school age and childcare age children during the summer months between school years. So as PEBT was a brand new, never before seen initiative that we worked hard to stand up very quickly, DHS relied really heavily on partnerships with other state agencies, as well as partnerships with other external and advocacy organizations statewide. So for example, DHS partnered with both Mary's team at the Department of Public Instruction and our Wisconsin Department of Children and Families to obtain information about which children met certain eligibility criteria. And then DHS was also simultaneously working with Feeding Wisconsin and other outreach organizations to ensure that information about PEBT and how to obtain benefits was reaching eligible families in all corners of the state. So as of the end of last week, our school PEBT program has issued over $211 million to over 292,000 individual students. Our pre-6 PEBT program has issued over $62 million to over 100,000 individual children. And our summer PEBT program to date has issued over $156 million to over 417,000 individual children. So we are in the midst of reviewing and evaluating new guidance from the federal government that details how school PEBT and pre-6 PEBT need to look in the 2021-2022 school year. But looking ahead, as Pandemic-EBT is not surprisingly tied to there being a pandemic in place, it's uncertain whether or in what capacity the program would continue beyond the end of the public health emergency. But that said, we hope that the partnerships we're building at DHS through the implementation of this program, as well as all the system and infrastructure enhancements we've been making, will continue to be impactful for food insecure families long beyond the duration of the pandemic. And I think that is all I wanted to share to get us started. So I'll hand it back to Maureen.
Those stats blow my mind every time I hear you say them.
Me too.
I hope everyone at home and at their work computers are, standing up and clapping. It is really, really remarkable. So, we started this conversation just thinking about the pandemic and how the federal nutrition programs were quick to respond and how the policy sort of shifted dramatically just because we wanted to have this conversation be robust and we can't really, ignore what's been happening in the last 18 months. But as you think about the questions that you want to ask, feel free to ask sort of what's happening during the pandemic, what do we see right now, what flexibilities are out there, but also we're going to shift now and look into the future. So you have sort of the expert panel here to answer any of the questions that you have. So feel free to put stuff in the chat as they pop into your head. But Corey, I wanted to sort of turn this back over to you and look at where do we stand right now with federal nutrition policy? What's happening in Washington, D.C., and what do we see sort of as the next steps? And part of this forum, we really want to ground this in collaboration and thinking about how we can collaborate as, community-based organizations with the, state agencies as some of these COVID flexibilities and programs sunset now. So just if you can give us a glimpse, we know that things change on a dime in Washington. So we're not going to hold you to everything, but sort of give us a sort of an idea of the landscape right now, if you could.
Yes, of course. And I was gonna start off by saying that I can't find my crystal ball anywhere. So my future predictions will be slightly limited because of that. But I also wanted to introduce myself because I think I maybe breezed through that when I first kicked it off. But I'm Carrie Malone-Smolla, and I'm based out of Washington, D.C. on Feeding America's government relations team, and I am a policy manager analyzing a wide range of federal nutrition programs, and excited to be here with you all. So in terms of where we stand now with federal nutrition programs, if you've had the news on and then probably promptly turned it off, as one should at this point because it's frustrating, you'll know that Congress is still negotiating 2 different bills and trying to determine which one will come first, what the size and scope of those will be, and things are still pretty, in summary, up in the air. I don't have much more good information to give you other than currently congressional leaders have set a deadline of, I kid you not, Halloween, October 31st, as when we should hopefully expect to see some more movement on this. Not to add to the spookiness of the holiday already, but hopefully we'll know more then. And in terms of in specific federal nutrition programs, so the main things that we are either expecting or currently Feeding America is advocating for right now, because it seems like the most likely provisions to be incorporated in these legislative vehicles include making summer EBT permanent. So Jess, it was great to hear you really teed me up for, we're not quite sure where things are currently standing, what's going to happen, and hopefully we can see this program invested in further, because as you've shared with everyone here, it's had an incredible impact. In addition to that, some nutrition programs that are possibly likely to be in the bills include the community eligibility provision, so lowering that threshold from, I believe it's 50 to 40 to allow a larger access for schools to be able to participate in that. That's another provision that's being considered heavily in these bills, along with the child tax credit, expanding that, making permanent in terms of the time and length and scope. That is, you've probably seen a sticking point, and so that's still being figured out as well. And it's not too late I really encourage everyone here who has collected stories and can share the impact of programs and the need to invest in these programs further. Like contact your representatives. It's still, the window is still important right now to show how important it is to invest. So I really encourage you all to do that, continue doing it. I know you've been doing it this entire time, so thank you again. But that's a brief overview of where things stand in terms of the immediate bills. And then beyond that, child nutrition reauthorization is on the horizon. Our team is currently so super hyper focused on the COVID recovery legislation, but wanted to tee that up as well as something that's coming down the pike as another avenue of important nutrition investments as well. So that is my brief update.
Yeah, that's fantastic. I think focusing on summer EBT and how important that is to kids in the summertime who rely on free and reduced price meals during school, and then thinking about community eligibility to provide school breakfast and lunch for free to all kids is so important. As Mary was talking about just how important it has been during the pandemic that we were able to use flexibilities to feed all kids for free in Wisconsin. So I'm going to hand it back over to Kari to talk a little bit about the impact of other programs on WIC during the pandemic. Think about sort of as these flexibilities for WIC sunset, what that means, and then partnerships with WIC, how we can help, what we can think about, how we can be innovative. That's a lot. And I'm going to throw one more thing at you. So Katie has a really good question in the chat, and I'm going to have each of you address her question as I hand it back over to you. But Katie's talking about what challenges to your program, or what changes to your programs were initiated during the pandemic that you anticipate that they will continue after the pandemic ends. So maybe starting there, like what changes happened during the pandemic that we think are going to continue, and then sort of move into what changes do we think are not going to continue, and how is that going to impact your program? So I think that might be a good way to frame this. And Catherine has a question too, but we're going to hold that for a minute. So let's think about what Katie's, and I'm going to turn that back over to you, Kari.
Sure, great questions. So one of the things I didn't mention before was one of the benefits that changed during the pandemic for WIC participants, which was very exciting for families. Mothers and children got an increase in their cash value benefit for fruits and vegetables. So normally they would get, children would get $9, women would get $11 per month. That went up to $35 per participant as part of the ARPA funding, American Rescue Plan funding, which started June 1st and ended September 30th. So that was a super great benefit for WIC participants. We heard a lot of great testimonials from families saying we really appreciated the increased amount in fruit and vegetables. I was able to buy a lot more, feed my family, some things I've wanted to try before, but didn't really have enough money to do. And currently, as part of the continuing resolution, which just passed, there was also another increase for this cash value benefit for WIC, which we actually believe is hopefully one of those changes that will continue past this pandemic as we look at children nutrition reauth and sort of some changes to the actual WIC food package in 2022. So that increase went up for Wisconsin families. It will start November and then go through the end of December. And then we really, really hope that there's something more in place, bill passes or another continuing resolution that continues this other increase out to September 30th of 2022. And those amounts are $24 for children, $42 for pregnant women and postpartum women, and then $47 for breastfeeding moms. So those are like 4 times the amount of food dollar or fruit and vegetable dollars that families were normally getting. There's a huge push to actually continue this this benefit, like I said, with children nutrition reauth and into make this more of a permanent change for WIC, which, it does have to do with inflation, and it obviously has to do with the National Academy of Sciences recommendation for meeting some of the recommended dietary intake for fruits and vegetables as well. So that's been a really exciting change for WIC, something families have loved. So the other big thing I kind of alluded to before was we operated under a physical presence waiver, which meant that WIC participants, that barrier was sort of eliminated, and that we had to go into the clinics, or families had to go into their local WIC clinic, I should say, to get the services and get their benefits. It was all done over the phone. So telehealth has become sort of the buzzword in WIC right now. So learning more about, the successes of providing more of that sort of virtual appointment or over the phone appointment is a big deal. Wisconsin actually is really benefiting right now because we are part of a national grant of 7 state agencies with Tufts University, which is a telehealth grant. So we are in the midst right now of implementing this grant program, which is actually focused on some online nutrition education platform that we're rolling out with some of our sort of agencies that are participating here in Wisconsin. So this and the other state agencies, we should learn a lot in the next couple of years of how successful telehealth appointments can be for WIC. And this is one of the other regulatory changes that we're really watching and hoping it is a big forward into 2022. it eliminates a lot of barriers for working with transportation issues that just cannot get into the WIC clinics. So that's another big one to look forward to. The other one that's enormous as well is online shopping. I can't say it enough. We have to get there with online shopping. That's where, we really realized in the pandemic how far behind we were in that area. And that is another regulatory change that we are actually very hopeful for, that actually becoming a big change for the program. It will shift a lot of things as far as, participants being able to order online and maybe do curbside pickup. We're not exactly sure what it looks like, but I'm really hopeful that, some of these it will be a big regulatory change, but I'm hopeful it's actually going to be one of those things we'll see also change with WIC. So I think those are what I want to highlight. And if I've missed anything, I can speak to it, but those are sort of where I see the future of WIC. And Wisconsin is actually, I just want to say, a national leader in some of these areas. We were one of the first states to actually implement the EBT program. So we are looked at as a national leader in a lot of areas. So I think we should feel good about where we're at here.
Yeah, I would say one of the first to do it and then watch other states struggle, right? So they had to turn to Wisconsin to learn.
Yep.
I love this panel. You are all such, amazing experts. We're getting great questions coming in. But Mary, I'm going to turn it over to you just to think about the next school year, sort of what's coming up, how DHS and DPI have strengthened the collaboration because PEBT sort of, made it happen, right? Like there was no turning back once PEBT sort of came back. But I also want you to think about Katie's question, which was what changes to your program were initiated during the pandemic that you anticipate that are going to continue after the pandemic ends. So think about that and then sort of transition into, the next school year and what's happening. And then other great questions that we're going to get to in the Q&A. I'm going to hold the rest of the questions to the Q&A.
Sounds good. Let's see. Starting with Katie's, what do we expect to extend past the school year? As Feeding America representatives say, we don't have a crystal ball that shows us exactly what's going to happen next school year. And then a lot of, schools and school nutrition professionals are really still in the thick of the school year. So what we have done really from our end is we've lessened the administrative kind of some of the reporting requirements that we usually ask, and we're really pivoting to technical assistance with schools. So making sure that whenever they reach out, there's somebody on the other end that can help them immediately with if it's interpreting waivers and guidance or just giving a little, extra morale boost and how to pivot your menu changes, or if we need to apply for this accommodation and that. So that's really where we're focused this year. And then some really positive things, some trends I would say that have kind of come out that we will most likely extend to the next school year would be a additional focus on breakfast, which Maureen, I'm sure you're happy to hear. A lot of schools really picked up breakfast during the pandemic as another meal to serve. So Wisconsin DPI, we just received a $2 million school breakfast expansion grant, which we are really excited to implement. So that will really help us, like I said, get that technical assistance, help schools who might have been considering breakfast and that now want to dive into breakfast, help them really achieve those sustainable programs in their school and show them how easy it can be to run those programs and really those direct benefits for the children and the students and the families. So breakfast has been really a really great standout that we've seen that will really continue. We also received some more farm to school funding, which is very exciting. So we'll be, like many agencies and organizations, we've really moved into lots of video training and kind of like a little bit more accessible training and technical assistance. So we're going to be working on farm to school with doing some peer mentoring and some school teams within farm to school, which is really exciting to get that knowledge diffusion across the state. Local supply chains and local foods are even more important these days as we see some of those supply chain disruptions with ordering food. So the more local we can be, sometimes that really helps get that food into the school nutrition programs and the community nutrition programs. And we really are seeing just a higher participation in child nutrition programs. That's just more kids eating meals. All meals are free, so that's a big incentive, right? And we hope that this higher participation will follow throughout the years. Even if there is a policy change or service changes, we really hope that children or families are enjoying these delicious meals that are so well thought out and really, really nutritionally balanced that really helps them think, learn, and grow. So that's a really good high spot, is that many schools are seeing just a greater level of participation, which is really great to see. And that really goes into health equity too, and making sure that these programs, as others had mentioned, the visibility has really grown a lot in this past year. So we're seeing school boards, we're seeing community leaders, parents, administrators kind of have a higher focus on these child nutrition programs and what does school lunch look like in our building, our district. And that's really great to see, because as everybody knows, it takes a village. And, the more connections we can have with those community orgs and everybody helping out to ensure children are fed and ready to meet the day in school, the more the better. So I think that lots of those community connections will, last for a really long time past this kind of difficult, challenging period. That's really been, like we said, strong partnerships. So I think that's a lasting effect. And then talking a little bit about PEBT, that's, partnerships across state agencies, which have really been strengthened. Jess was saying there's lots of new things. So that means new partnerships, new collaborations. I think also schools are understanding if we ask for data and they can see the direct benefit for their families. So that's been really nice, and seeing like how smooth that has been through the state agencies and getting that PEBT out. Yes, we're really excited about that cross-agency collaboration, and then seeing that throughout the community too.
Yeah, that's fantastic. I would say, to Carrie's point that we were a leader in getting WIC EBT going, we were also a leader in Pandemic-EBT, right? And not only did we lead, we got it done well. And I've watched a lot of states across the country turn to Wisconsin to see how to do it better. So Jess, sort of grounding in Katie's question of like what changes initiated during the pandemic do you anticipate continuing after? And then thinking about partnerships and planning as some of these COVID relief programs end or sunset, or frankly, just morph into something different.
Yeah, absolutely. So I think that's the theme. Partnerships was the first thing that came to mind when, you shared Katie's question about what you hope will continue beyond the pandemic. Obviously, sounds a little bit cheesy, but it's true nonetheless. That we hope these strengthened partnerships will last well beyond the pandemic. At least in terms of PEBT, they were absolutely critical to the program's implementation. Like Mary mentioned, definitely partnerships with other state agencies were key in terms of helping us disseminate information, gather the data that we need, develop processes, bounce ideas back and forth, but also relationships with advocacy organizations like you guys at Feeding Wisconsin were so critical and mutually beneficial in so many ways. DHS would provide data and up-to-date program information to agencies like yours. You guys would use your connections to target and reach certain populations that really needed the information and maybe based on the data weren't getting it as readily for whatever reason. And then, I said mutually beneficial, then more people receive the benefits, increasing overall, food security statewide. So definitely partnerships, not only with other state agencies, but outreach organizations as well, is something that has been strengthened and hopefully will endure long beyond the pandemic. The other thing that immediately came to mind as what I hope will continue is the speed with which programs can be stood up and the flexibilities that they can absorb, which, as many people know, is not super typical of government work. Programs like this normally take years, start to finish, to get up and running, whereas these took a matter of a few months. Just the nature of the situation we were in, the urgency, but also, really the fact that we were able to partner and sort of come together to make things happen quicker than they normally would. Now we've seen that it's possible, so hopefully it can continue in other ways after the pandemic, when the sense of urgency isn't quite there, but we have the same end goals in mind. Only other thing I would say to answer Katie's question and to your general question, Maureen, is that obviously PEBT may not continue beyond the pandemic, but the work put into creating PEBT and summer PEBT, especially as Kari was alluding to, will hopefully have helped lay the groundwork for a summer EBT program moving forward, whereas kids would be able to get free meals during the summer months between school years. I think a lot of the work that we've put into these programs has, or I would hope, would make the facilitation of that program, assuming legislation passed, a lot smoother and quicker, just because we know, how to reach the right populations. We know how to get the benefits to them. We just have more of the pieces in place already because of the pandemic and PEBT. So I think, those are things I hope will last long beyond the pandemic.
Yeah, my desk is not made out of wood, but I'm continuously wanting to knock on wood when you guys are speaking. Yes, I hope continuing beyond the pandemic, right? I think as we suspected when we started, not only do we have experts on the panel, but we have a lot of experts in the audience as well. So we're getting some great questions. I'm going to put this one to Kari and Jess. So Jess, I want you to take off your PEBT hat and put on your SNAP hat and your expertise in FoodShare. I know, sorry. You're good at two things. That's what happens when you are an expert. So Catherine is asking if the monthly child tax credit continues, hopefully alleviating a large portion of childhood hunger. Are there plans to focus on other populations, such as the growing elderly population? So I think that maybe Kari thinking about policy changes or discussions that are happening in DC, and then just maybe talking about, what Wisconsin looks at and making sure that we reach populations that need assistance, particularly with SNAP, that beyond sort of the children that we've been talking about this morning or focusing on this morning.
Yeah, I'm happy to start things off too. So I think it's a great question. And one thing that immediately came to mind was that I think I didn't even mention yet, the revision of the Thrifty Food Plan and the permanent SNAP increases that resulted because of that revision. So that is obviously historic. And a lot of my colleagues who have been working in this space for many, many, many years are detail that as being one of their most proud and greatest excitements of working in this space. So I don't want to, I would be remiss to not mention how important that is. And I think that hopefully will also target seniors who are in need of food as well. So anytime that we can get more SNAP dollars into the hands of people who need it, that will help with food insecurity. Additionally, I think a lot of, and Jess might be touching on this too, some of the waivers and flexibilities that took place in the SNAP program, such as electronic signatures or other kind of like barrier flexibilities. Hopefully we can see a farm bill is around the corner. After child nutrition, I think, again, don't have my crystal ball. But those are kinds of things that as you can kind of think about ways in which to increase access to certain populations. Collect those stories, especially collect stories if there's waivers that took place during COVID-19 that were especially helpful to reaching certain populations, and you would want to see those become permanent. Keep those and share those with representatives, because those will help to showcase what kind of improvements can take place moving forward in the different kind of legislative vehicles that we'll see on the horizon. So with that, I can pass it to Jess to touch base a little bit more as well.
Sure. Thanks, Corey, for setting that up. I think, as I mentioned, my main project for the last year has been PEBT. But that said, I think in terms of will we be able to be focusing on other populations as it relates to SNAP or FoodShare in Wisconsin, I immediately just have to think to all the other members of the FoodShare policy team here and the projects that are on their plate. And off the top of my head, I immediately was thinking about, someone on my team is working on projects focused on elderly populations and streamlining their ability to get and keep their FoodShare benefits. Some increased interest around how we handle college-age students during the pandemic. Hopefully will, transcend just the public health emergency. There's projects around not only veterans, but now most recently with refugees and how they access our FoodShare benefits. So certainly I think the child tax credit is taking us a long way in alleviating childhood hunger. And I guess that's been at the forefront of this conversation, but lots of other populations remain at the forefront on our team and the projects we're working on here at DHS. So absolutely the answer is yes, we will be continuing to focus on other populations and try and alleviate hunger within those as well. One thing I did think about too is Corey mentioning the revision of the Thrifty Food Plan, and also there's new ARPA funding that we're in discussions internally right now, trying to figure out how to best use it and apply it toward reducing hunger statewide. One of those projects that piqued my interest especially is a food equity data analytics sort of project that we're trying to look into. And I think right at the beginning of this call, Corey mentioned, it's nice to be able to take a breath and think back on everything that's been happening. It doesn't happen often lately that we can stop and, evaluate what's been done. It's been, go, go, go for so long, but those sorts of projects that we can now kind of incorporate into our repertoire, so to speak, I think will be really interesting and allow us to target better how we're spending this money, and not just at childhood hunger, but figure out which populations can most benefit from our work.
So I think that people in the audience are recognizing all the hard work that you're doing too. Tony Zek, who is an expert in our audience, who does nutrition education and SNAP Ed throughout the state, says, thank you very much for all your work, flexibility, and creativity during the pandemic. And then Kari, I'm going to have you start with his question because I think you mentioned this sort of, in a lot of your thoughts. Do you have any suggestions for how our programs can work more closely together to help alleviate hunger and improve nutrition? And then I'll hand it over to anybody after Kari who wants to hop on in.
Sure. I think one of the challenges that we saw with WIC and have been seeing for a while is participation in WIC, not only in Wisconsin, but throughout the nation, has been decreasing. And, although there was tons of resources available for families with, increases in EBT and school food, and just the availability of food was probably more than we've ever seen. And WIC did see a small uptick in participation when the pandemic first, kind of started in that March, April, May 2020, and then sort of saw it sort of kind of flatten out and decrease a bit as it was sort of before. And really it, gets us thinking like, why aren't participants using their WIC benefits? But, sometimes we sort of have to step back and think, sometimes, WIC has a lot of requirements for participants. And, I think what the pandemic has shown us is we've got to sort of streamline some of those things for families to make it easier. So I think, all of us working together, and I'm not even sure many programs really probably even know that WIC that's been an issue for WIC, and families have decided to kind of enroll in WIC, but actually not really use their benefits, because we're able to pull some data on redemptions and what people are buying and if they're buying it. And one of the things is WIC benefits actually expire every month after 30 days, where I know that's different for FoodShare. They roll over. So families have some more flexibility with that. Now, I'm not saying that that's going to be an option for WIC, because that isn't on the table at this point, but those are just some big differences. And I think working together with our medical community really has been important for us during the pandemic and these other programs. So we all sort of know what each other is doing in dealing with our participation in programs. And I know Jess and I are going to meet soon too, to actually talk about what are each of us doing with families during this time, and how can we better work together, and how can we get families, as I say, to use WIC first because it expires, and then go on to your other benefits to sort of maximize your food dollar for the month. So those are things we're going to hopefully tackle and talk about moving forward. But it does really emphasize the importance of all of us coming together at the table.
Anybody else want to jump in? Okay, we are at about 4 minutes to the hour. We were going to break out in small groups, but there are a bunch of really great questions from really smart people in our audience. So I'm going to keep going with the questions while we have this amazing panel. And then when so we're going to run over a little bit, I guess is what we're saying. This isn't a question, but I just wanted to highlight it for folks who may not be monitoring the chat. But Patrick Boyle, who runs the Sheboygan County Food Bank, said, is there a brief one-page summary out there anywhere that we could share with our boards, donors, et cetera, that would help us advocate better? So Steph did answer that and directed him to her email, as well as Feeding America National. Those links are in the chat. So feel free to go in there. I know additional people were saying that they would also like to have a summary. And so those resources are out there. Feeding America Eastern Wisconsin has those as well. So please feel free to follow up with Steph Dorfman, who's the Executive Director of Feeding Wisconsin, and her email is in the chat. So we're going to go back to the questions. We've got a question from Emily, who says, I love hearing the theme of reducing barriers from a number of the panelists. Is this tied only to the pandemic, or do you think there is a broader cultural change happening within federal programs and the public? So, Mary, I think you were touching on that when you're talking about school boards and getting the community involved and how important that was. You want to touch on that with this question?
Sure, great question. I would say there's a few different cultural changes. I think people became aware, that children and youth get, anywhere from 55 to 70% of their daily nutrition through school meals. And that's a pretty large percentage of nutrition for youth. So understanding that big impact that school meals have, I think that is just a cultural change by visibility of, visibility of the programs, and then visibility also of these really hardworking school nutrition professionals. Seeing those people out in front of the school handing out meals is more visible, in that to-go line versus, having to see somebody in the kitchen. And then I also wanted to touch just with the transition to virtual land that we're living in. It's a lot easier and more efficient to set up meetings and to cross-collaborate with a lot of different state agencies. We've been able to do a lot of more virtual trainings with our schools and our school nutrition professionals. So we can do one-on-one trainings. We've been doing lots of even just technical assistance on how to access our website. We've really improved our website with the different materials and just accessibility within that. So that's been a real highlight, is kind of meeting with people virtually and understanding how a lot of times, especially with school nutrition professionals, they're very busy making those meals, during the day, and their schedules are really tight. So being able to fit in 10 minutes to, meet face to face and see somebody, it's just really, really special. And being able to either provide very, specific policy information, or just to hear frustrations, celebrations, things that are happening on the ground, being able to elevate those, so through social media and different things like that. And then if there's major issues, we're able to take those and bring them to the USDA. So that has been a really nice, just kind of improvement of communication in the real time. And we've also been able to do live trainings, which have been a really nice thing. So we can do some live trainings online. And then similar to this, we can have a real-time back and forth chat. So if there's questions or different things, don't have to rent out large conference rooms, have people pay for them, pay for travel, take time off. It's been really, really beneficial. So I think that's a culture change just for everybody, but it's definitely apparent within our world.
Yeah, there are silver linings, right? Anyone else have thoughts that they want to jump in? Okay, Kari, I'm going to give you a pass on this one, but this is for the other three. And this is one of the issues with having experts in the audience, right? We've got a pretty deep policy question out there. See which one of you wants to jump in. Sarah asks, would summer EBT impact summer food service program or the seamless summer option availability?
I can jump in, and then others can jump in as well. I assume this is asking about, would making summer EBT permanent impact these things? I'm going to answer it in that way. Our stance at Feeding America is that we think that there's room for all of it to exist at once, and that is very important. And so currently, right now, in terms of writing out the legislation, once we know more and see more and learn more, there will be a team of advocates making sure that nothing is kind of like butting up against each other in a way that will be harmful to either program. And that and there's different approaches to reach people, and different ways to reach people in the ways that work best for them. So my optimistic view is that there'll be a space for all of that to coexist together.
I didn't even do the acronyms, but there could have been a lot of acronyms in that question. But thank you, Sarah. That was a good question, because I think people do think about that, right? Like, are we going to eliminate one program by starting another program? I think one of the things we learned with PEBT was you can successfully run a program like PEBT while also seeing the child nutrition programs feed an awful lot of kids with the seamless summer option and grab and go in our communities. So I think we have sort of experience with that during the pandemic. So we have another question, and this is really from experts from the emergency food. So Corey, I'm coming back to you for this. But we're talking with experts in Sheboygan and then in the Kenosha area that have seen demand for emergency food drop dramatically because of the increase in the federal nutrition programs. But this is just anecdotal information that they have, right? They don't have any hard data. Are there any current studies that lay out all of this in more scientific ways, providing a direct correlation between the increased benefits and the reduced demand? And that might be something that we need to follow up later, because there are a lot of things happening across the country right now. We do know that the USDA released 2020 food insecurity data, which would have shown sort of the impact of the federal nutrition programs on that. And they sort of remained stagnant sort of over 2020, which was remarkable. But Kari, now I'm answering the question. So
Yeah, no, that is exactly where I was going to go. I was going to say, take a look at the USDA 2020 food security report. And what that highlighted is exactly what you just said, is that we would have expected to see, without federal nutrition investments, skyrocketing rates of food insecurity. And what that report showed is how everyone was right to say that the best tool is strong nutrition programs, because it stayed the same. And we know that that is because of the investments that we saw. And for people who really like graphs and charts as well, Politico used a lot of that data recently in an article. And I think if you just search Politico food insecurity chart, it'll be the first thing that comes up. And you can see kind of, it's using the census biweekly survey on food insecurity. And you can see the chart of like dropping food insecurity rates based on that survey. And then they highlight the lines in which stimulus checks went out, in which SNAP increases took place. And then the most drastic drop is the child tax credit. And so I thought that was a really great visual to really kind of drive home the point of advocating for nutrition programs, and then being able to see the impact of them so clearly, because that is the best evidence for moving forward to be to advocate for these programs, because you can see the data that shows how essential they were for fighting food insecurity. So you answered the question exactly how I would have, and it is essential stuff, and an excellent question. And I think Stephanie also highlighted it more. There we have data as well on feedingamericaaction.org, and it has state-specific data too. So you can also use that to kind of highlight the strength of programs, and feel free to reach out to me as well with any follow-up questions.
So I'm going to use this as the last question for the panel, and then we'll break out into our small group discussions, and we'll have about 15 minutes, I think, left to do that. But we're getting sort of more questions about the
I don't know how to respond.
Oh, my watch is talking to me. The emergency food network and the federal nutrition programs, right? And sort of the intersection between both of those. And so I'd like each of you to touch on sort of what we've talked about with this panel, I think, throughout, which is how can community-based organizations, in this case, like focusing on emergency food providers and hunger experts in the community, people who deal in this space but might not be at the state agency, help not only sort of bolster the federal nutrition programs, but maybe the opposite way as well, how you can help the families that come to you for school meals find emergency food in their neighborhood, or think about how FoodShare outreach sort of works both ways, right? To connect people not only to FoodShare, but to think about emergency food, or how the emergency food network can help connect folks to WIC. So just thinking about innovations and partnerships, I think that's a nice sort of button on the end of this. And then we'll go with, we'll start with Jess, and then sort of work our way back to Kari and finish it out. And then we'll break up into small groups, unless I see any other questions come in. But Jess, you want to just take sort of that word cloud that I put out there and make it articulate?
Yes, I will try. Yeah, so the first thing that comes to mind for me, and I should preface this by saying I think in this group am the newest to government work. So I'm still learning, all about these intersections between what we do at a state agency and how we work with the federal government, as well as in the other direction, how we partner with, on the ground emergency food providers, as well as outreach organizations like Feeding Wisconsin. But the first thing that comes to my mind in hearing that question is all about transparency. So understanding, as a state agency representative, all of the resources that are available to Wisconsinites, and being able to not just know what exists, but how it works, who's eligible, when is it available, when are they open, what other sorts of assets or barriers might someone come across in trying to access emergency food in our state. So once I have that information, being able to share it through our state agency channels as well. And, when someone calls our team to understand more about their FoodShare, we should also be able to share information with them, not just about FoodShare, but about, what everyone else is doing and, knowing where this person lives, what's in the vicinity that maybe DHS doesn't necessarily facilitate or have a direct hand in. But if it means, the betterment and increased food security of that person, it shouldn't matter whether DHS is the one, running the program. So being able to really increase our awareness as a state agency, but then use that information to transparently share it with whoever needs it, I think is a strategy that would go far in improving the lives of Wisconsinites who are hungry and facing food insecurity.
Mary, any thoughts?
A couple of thoughts come to mind. Okay, unmuted. A couple of things come to mind. I would say something that might not be too visible would be each school that participates in any of the USDA child nutrition programs in schools are required to have a school wellness policy and a school wellness plan. So that's a federal requirement. Some schools have it really robust. Some are still in the planning stages and maybe could use some community participation or some help with that. So that could be a really nice kind of school-wide health and wellness plan and a little push to bring different parts of the school together around wellness. Lots of equity work to do within that also. And I would also say that, we are still welcoming a lot of new programs this year into the National School Lunch Program, the National School Breakfast Program. So there's always room to join, and we love accepting new programs. Not every school is signed up for free meals. So if you know a school that doesn't offer meals for its students or don't offer, those nutritional, well-balanced meals, please contact us at DPI School Nutrition, and we would love to talk to you about joining the school nutrition and the child nutrition programs. They've really been shown to have a huge impact on student wellness and academic success. So we're here to welcome new programs, then also to help those who have been running programs for a long time, succeed and getting even better. So I would say those are two things that you could kind of advocate or work on the community level if you're not a school employee and you want to affect change within those.
I love that answer. Yeah, that's fantastic. Kari?
Yeah, so actually for WIC, referrals is actually a pillar of the program. And, knowing about the services for local WIC staff in their area is imperative. And many of them are very versed in, where to point people, who may need additional food, whether it be at the pantries or have they applied for FoodShare. So all of these things are extremely important. I think what sometimes gets lost is when people change positions or, if things change in the program, just keeping up to date on what's all happening. And I know we all shifted dramatically during COVID, and what I wish would have happened more even at the state level was a more for food security, leadership taking some of this on to talk, which could have trickled down into our local programs, but just keeping all of us informed of what's going on and what resources are available. WIC's been doing this, that's part of, like I said, what the pillar of the program really is. But I don't think sometimes even our message is clear that although we do provide supplemental foods, there's many other resources people can get connected to for additional food needs. And we also set ourselves apart from other programs because of the nutrition education and breastfeeding support we provide. So, what am I going to do with all these foods that I have in my house? How am I going to cook with them? How am I going to use these fruits and vegetables? I mean, that's what really sets us apart from the other programs. And I think, other programs helping lift that up for us would be extremely helpful too. So, yeah, I think that's, just us working together at a state level and then trickling that down to the local level would be, super helpful.
Yeah, I love that. I think to Tony's comment before, right, that we're better when we all work together and sort of figuring that out. I think a lot of states during the pandemic were thinking about, do they need one person that's sort of coordinating all of these programs, because there are a lot of programs, right? And I think it is really important to make sure that we're all cooperating together and working together, because we're all trying to accomplish the same goal, right? And Corey, before I hand it over to you, I would be remiss if I did not mention that Steph plugged tomorrow. So she said that this is a great question to also take into the panel tomorrow for emergency food panelists during the 21st Century Emergency Food Programs panel. So I'm going to have Corey give us her thoughts, and then I'll give you a couple of housekeeping, and then we'll break into our small group discussions.
Great. Yeah, I'll keep this brief and just say one of the top line things that I really want to underscore with what everyone has said is the collaboration, transparency, communication element of it all. And I think one thing that I've seen as being kind of the biggest strength during this time is taking feedback as to what's working, communicating that to whether that's someone that if a family comes in during a drive-through distribution early in the pandemic and is saying this part's not working, this part is, communicating that to food bank staff communicating to us at the national office that this is actually something that is in legislation, and if we could waive that or change that, it would make life easier for food bank staff and for the family seeking food assistance. And then we then talk to USDA or whatever the entity may be at. I feel like there was a time in which that pipeline of communication didn't take place. There wasn't as much relationship building, but during the pandemic, it was like, we have no other choice. Like, we have to find who to talk to. Like, we have to call that person right now. And I hope that feedback loop stays strong going forward, because like you said, we're all here for the same purpose, and it's to combat food insecurity and get meals on the table. So I think that's one thing that is a strength about working together during the pandemic, is just communicating how we can all advocate for the change that we want to see.
Well, I want to thank this remarkable panel, not only for the work that you did during the pandemic, but for your time today to share your expertise with all of us. I really think it's been remarkable. I've had fun, so I appreciate that. So now we will break out into our small group discussions. You do not need to leave this page to find it. Basically, if you are on the live screen, you just need to scroll down. The panel discussion rooms allow up to 13 attendees at each one. So I'd start with one and move your way over to attend one of the small groups. So we make sure that we have folks in each room. And please feel free to rate us and tell us what we can do better, what you enjoyed, what you think would be great for next time, because we hope that you've all marked your calendars for April 24th through the 26th at Chula Vista, so we can all be together and learn together and have these conversations continue. So thank you everyone for joining us today, and please feel free to break out into the small group discussions now.